New data suggests social distancing measures are working to curb the spread of coronavirus, but experts insist now is no time to let up. From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Monday, April 6th, 2020. I'm Cliff Baumgartner. Here's the latest from WREL.com. Today, a team of local health experts said that hospitals across North Carolina are likely to be overwhelmed by COVID-19 patients if the state stops practicing aggressive social distancing policies. However, that scenario is far less likely if the state maintains those policies beyond the end of April, when Governor Roy Cooper's 30-day stay-at-home order is set to expire. The projections released today were crafted by an independent collaboration of a dozen epidemiologists, researchers, and public health experts, whose goal was to predict how likely hospitals would be to see shortages of beds from now through June. The forecast shows that without social distancing measures in place, about 750,000 people in North Carolina could be infected by June 1st. With current measures, however, the number drops to 250,000. A significant decrease, which experts say indicates social distancing efforts are working and need to be continued. Researchers stressed that the work, which has not been peer-reviewed, is still preliminary and will be revised with additional data over time. They also added that they're not recommending any specific policies, just those that have had similar impacts as the ones currently in place. Speaking at a press conference today, Dr. Mandy Cohen, director of the North Carolina Department of Health and Human Services, said this data reinforces the need and impact of the state's efforts so far.
Social distancing flattens the curve so that fewer people get sick at the same time. We know when people aren't coming into contact with each other, it lowers the chance that they will either catch or pass on the virus.
North Carolina now has at least 124 confirmed recoveries from COVID-19, though the number of infected continues to rise. At the time of recording, more than 2,900 people have tested positive for the virus in the state, and at least 42 people have died. To stop the spread of coronavirus, the North Carolina Division of Prisons will not accept offenders from county jails and will dramatically reduce the transfer of inmates within state prisons for 2 weeks, beginning at 6 p.m. on Tuesday. Over the past week, 7 inmates in state prisons have tested positive for coronavirus at 3 different prisons. 1 at Johnston Correctional in Smithfield, 2 at Caledonia Correctional in Halifax County, and 4 at Noose Correctional in Goldsboro. Over the weekend, face masks were distributed to all staff and offenders at those prisons. In a statement, Commissioner of Prisons Todd Ishii said, quote, "We must deny this virus the opportunity to spread. It has gotten into 3 of our prisons, and we must contain it there to the greatest degree possible. This is imperative for the health and safety of our staff and the men and women who are in our care." End quote. Prison officials are already shifting inmates scheduled for release over the next 2 weeks to areas close to their homes, where they will be released in accordance with their individual release plans. No offender will remain incarcerated past a scheduled release date. New inmates in the prison system who have remained free of COVID-19 symptoms are being transferred to their assigned prisons over the next 2 days. Staff medical screenings have been enacted at every prison in North Carolina, including temperature checks, in an additional effort to reduce the chances the virus gets into a prison. Today is the last day Durham Public Schools will distribute meals to needy students. Although many families depend on the meals, school officials say they had to shut it down after an employee who was distributing food and instructional materials at Bethesda Elementary School tested positive for the coronavirus. A week's worth of student lunches will be handed out at 13 schools today before the system shuts down. Families looking for meal assistance can contact No Kid Hungry, which is providing food options for people in Durham. For information about the program, text FOOD-NC, that's all one word, to 877-877. Again, text FOOD-NC to 877-877. Starting today, Wake County families living in hotels may be eligible for new financial assistance to pay for housing. Wake Prevent, a program started last year by Wake County's Housing and Community Revitalization Department, currently helps about 100 households a month cover the cost of housing. Recently, the pandemic has increased the need for housing assistance, especially for those living in hotels. People qualify for financial assistance if they live in a hotel, have lost income due to COVID-19, and have children who are younger than school age, or who are enrolled in a Wake County public school system or local charter school. For people who live in hotels but don't qualify for help with Wake Prevent, the North Carolina Department of Justice is stepping up. The DOJ sent a letter to nearly 100 hotels and motels across the state after being notified that those businesses may be threatening to evict residents. Among its other details, the letter read, quote, "We write to inform you that evicting these individuals without a court order may constitute violations of North Carolina's landlord, tenant, and consumer protection laws," end quote. County officials say that while they don't know when life will return to normal, they will do everything possible to protect their residents in the meantime. This has been your Coronavirus North Carolina News Brief for Monday, April 6th, 2020. Remember, if you like the information you get from this podcast, let us know by giving us a rating and a review in whatever podcast app you use. And while you're there, be sure to subscribe so every new episode is delivered straight to you. Thanks for listening.